Segment 3, Doc. Come on. This one's all you.
I love this one.
You like this one?
I went viral with this one.
You did.
I did. Millions of views, lots of hits. When is grooming life or death?
That's what it is. Check out the video.
Come on.
Check out the video.
Today's episode of Real Talk with Dr. Owens. Is this a rug for the clinic or a pet matter? If you guessed matter first, then you are correct. You can see our patient today is in a lot of pain due to lack of routine grooming.
We shaved them all the way down so we could assess the skin, clean, and treat. As you can see, urine and feces are trapped in the fur, and skin is raw and inflamed. Don't let your fur friends suffer. Make grooming a regular part of their care routine. We will thank you for it.
Wow. Yeah. Wow. So the question here is, when is lack of grooming absolutely become a life or death situation?
How long can you hold your breath? At some point, you gotta breathe. It's that essential, especially on certain breeds that require that type of maintenance. Those are very fluffy dogs. Minimum, you should be bathing and grooming that animal at least once a month. Minimum, 12 times a year to keep it down. 99.9% of my medical-related issues on pets like that are grooming neglect issues. They are synonymous. So skip that month if you want to. I'm going to find something the following month. So now you have a big grooming bill and you have a medical issue to resolve immediately.
But also, they got I guess that pet smelled in a certain way, right? You guys pulled feces off of that, or urine was on that. Yeah. And I mean, we're in Las Vegas, for those that don't know. We live in the desert. It's got to be hot. So that thing had like a super blanket on it.
I know. It was a very sensitive case because I knew mom just didn't know. Number one, I went in the room. It's instant smell for me. Outside of just, hey, she looks good. Let me get a rabies shot. Rabies shot. No, we don't need a rabies shot. Something else is going on. Please allow me to look at it. And a physical exam from tip of the nose, tip of the tail will help me get my spider senses going, right? When we found out it was located down low, that pet was also obese. So she couldn't give you signs of licking down there, trying to soothe that itch that will never get soothed without medical therapy. And then the matted fur on top of everything else, you couldn't even see what was what. So that took a lot of attention to detail. Thank goodness mom was compliant. She was, again, mom. So when I explained it to her, I said, hey, you know, our patients get urinary tract infections just like us women do, right? And then she started understanding. And then I talk about the chronicity of how long this has probably been happening. And that can just be based off of when was her last grooming appointment. A long time ago. It's been a long time ago, right? And this was probably like 118 degrees that day in Las Vegas. So depending on where she's at, for the smell, they become smell mute, because that's just what I'm used to. Got you, right? If you stink really bad for so long, you're like, I don't smell nothing. Unc's like, we do. We do. So, I mean, she needed that appointment. That pet also required sedation, and she was grandma. She was an older patient. And this wasn't her first UTI or vaginitis situation. She's probably been dealing with that all her life. Undulating, up and down, up and down. And then we finally said, hey, you know, we can do better. So what did we do? She allowed me, we provided her with a treatment plan. Okay. I already knew the amount of pain this pet was in and the compliance. I'm not going to scratch and itch and move that tissue around that's already severely agitated underneath. And the infection down there, it was so tremendous. You had folds on top of folds, on top of fur, on top of funk, right? And that's a lot of issues that I don't need you to continue to suffer while I'm shaving you. And that was probably like an 1.5 hour procedure.
With multiple people, because you have your techs there, you're there, there's a lot of people involved. You said you sedated it?
Oh yeah, sedation. But after we do our appropriate diagnostics, I understand there's been a level of neglect in this case, right? With neglect comes things you just don't check under the hood. Before I put your baby under sedation, I want to make sure she's a good candidate for said sedation. Did you know kidney failure can be a primary UTI that never got resolved?
I didn't know. Probably most of those people there didn't know either.
Yeah, what happens? If you don't do anything about your urinary tract infection, guess where it's going? Upstairs, right? And they're all connected. So if you don't give that immediate attention at some point, the body can do so much, but the bacteria and the infection will say, what else we got?
So I guess you're alluding to, you had to do blood work.
For sure.
You had to do, because you were sedating the pet.
Correct.
And these are probably some of the points that people try to, and I don't want to say like different veterinary practices, right? Different veterinary practices, they practice differently, right? So there's, I mean, I remember back in the day we first met, one of the big things that we talked about was the quality of medicine, right? Because there's different levels of it.
Yeah.
So I'm assuming that some people will try to placate to the pet owner, possibly putting at risk the actual patient, right? Because there's the patient and there's the owner.
Yeah. We just say pet because the pet is the body that's enduring the pain, discomfort, and like that's a chronic slow death. And unfortunately, I've also witnessed patients that have died from a primary urinary tract infection, and a year later they're in complete kidney failure. And I begged that owner to say, "Hey, you just got this animal. Let's just see what you adopted."
Right.
No, she's perfectly fine. She looks good. Okay, now my level of care was maximum, and it's just a regular conversation. But at some point between now and 365 days, I'm already alluding that something could be wrong. And if you see something, but you won't, please bring it up and let's follow up on this conversation because she ain't gonna tell you about it. In this case, it only had a UTI in the bladder. She had vaginosis and multiple skin infections all over, on top of being obese. And it wasn't just a regular urinary tract infection. It had cocci, rods, yeast, all types of bacteria. It was a melting pot, a culture medium just in her vagina and around her anus. So whenever she's pooping, it gets impacted within that private area until she just can't take it anymore. And where's it gonna go? She was matted, right? The exit was closed. Right. So it just sticks down and now you're in a form of constipation. So multiple issues with an obese senior citizen that can't speak for itself with a fur coat chinchilla in the middle of summer in Las Vegas, Nevada. It's too much for anyone to endure. So to your point, yes, I care about the pet. I empathize deeper. I have a different understanding than I would say most vets. But I'm willing to take the trauma from you abusing me because you think I'm too pricey or it's too much or I'm ridiculous, but I'm going to make sense. And again, the joke's not on me. You don't hurt my feelings. It's hurting the patient that we have here. On top of the weight, when it comes to sedation, to your point again, what cost? How much did that pet weigh?
That was a lot. That was about 100, 110.
Probably about 125, 130 easily. So that's drugs. It costs more the more you wait. If we did the exact same treatment plan on a Chihuahua, they're a lot more affordable, right? But when you have that type of mass in a patient and that's the type of breed you want, you might want to cover your butt and get some insurance because again, it's going to happen. Then I tell her to follow up, right? That's a different conversation because she's already prone to urinary tract infections. This wasn't an issue of like, hey, I fixed it, but it's not a home run and that's it. You got to maintain that, mom. Get up under there and help her. She can't wipe her on her own. So that's some part where you need to say, hey, let me put on my nurse hat for my baby that's in my house 24/7 because I don't want to revisit this issue. She didn't deserve that.
Right. And what you guys are getting right here is this is a lot more than just grooming because what they had to do, because the pet wasn't groomed properly, it created a situation that created a medical necessity.
There you go. And that's the difference between life and death. So if this case, she declined it, nope, not doing it, you're ridiculous, just give me antibiotics, systemic or topical. That's like putting, cologne on poop. It's still shitty smell. And that's the problem. And again, it comes with other issues that are going to brew inside of that pet in ways you don't want to imagine.
Yep.
There you go. And a lot of things, last tip is like, when it comes to the medicine part of it, you really have to understand medical grooming with sedation and medications versus congrats. Oh my God, Dr. Owens is putting his groomer hat on. No, that was a therapy. That was a treatment plan to assist the best way possible to make it easy for all parties, including the pets.
There you go. That was segment 3. When is grooming life or death?